Welcome to our patient education video on understanding the shoulder joint, brought to you by Adelaide Shoulder and Upper Limb Clinic. I'm Dr. Oscar Brumby-Rendell, an upper limb orthopaedic surgeon, and I'm here to guide you through understanding the shoulder joint anatomy and common causes of shoulder joint pain. The shoulder is a unique and elegant joint of the body. It has the greatest range of movement of any joint, but this can lead to problems. Understanding the different parts of the shoulder can help understand how it functions and also how injury can disrupt normal function. We can divide the shoulder into anatomical sections: the bones, ligaments or labrum, tendons, muscles, and bursa. The bones are the scapula or shoulder blade, humerus or arm bone, and the clavicle or collarbone. The shoulder joint is made from the articulation of the humeral head resting on the glenoid, which is the socket on the shoulder blade. The shoulder is a ball and socket type joint, like the hip joint. The difference, however, is the shoulder has a much greater range of movement compared to the hip. This is because the shoulder socket is much more shallow. This great range of movement comes at a cost, with shoulder dislocations being much more common than hip dislocations. The acromion makes up the roof of the shoulder joint, and this space between the humeral head and the acromion is where the shoulder impingement and bursitis arises. The clavicle has a joint with the acromion to form the acromioclavicular joint, or AC joint. It is held by strong ligaments between the acromion and clavicle, and also from ligaments that attach to this bony prominence called the coracoid. Next, let's look at the ligaments or labrum of the shoulder. The labrum is a soft tissue ring around the socket that helps keep the shoulder in joint. It makes the socket bigger, reducing the chance of dislocation, but being soft and flexible to allow large range of movement. If we think of a shoulder joint like a golf ball sitting on a golf tee, if we didn't have the labrum, the shoulder joint would be very unstable. A golf ball on a simple wooden golf tee can easily be knocked off, but on a larger golf tee with a rubber ring, the ball stays put a lot more easily. The labrum is commonly injured during a dislocation and detaches from the socket, thereby allowing the humeral head to more easily fall off in that position. The tendons of the shoulder joint are very important. They are the rotator cuff muscles and the biceps tendon. Let's start with the rotator cuff muscles. There are 4 of them: supraspinatus, infraspinatus, teres minor, and subscapularis. They all work synergistically to move the shoulder joint through rotation, elevation, and abduction. The larger deltoid muscle is then used for powerful movements of the shoulder. Without these smaller rotator cuff muscles, the deltoid struggles to move the shoulder on its own. The supraspinatus is the most common rotator cuff tendon torn and is also involved in the impingement syndrome by rubbing on the undersurface of the acromion. The biceps tendon is a unique muscle tendon due to it attaching to bone inside the shoulder joint. The biceps tendon can suffer small tears and inflammation from impingement and be a common pain generator in the shoulder. This video from shoulder arthroscopy shows a normal biceps tendon, and this video shows an inflamed and partially torn tendon. That was a pain generator for this patient. Whilst the rotator cuff is often the culprit for shoulder pain, there are multiple other pathologies that can also cause pain in the shoulder. The shoulder is a complex joint and needs careful assessment to determine the pain generator. Bursitis with impingement and biceps tendinitis is common and can also be present with rotator cuff tears. The subacromial bursa lies on top of the rotator cuff tendon and provides a cushion between the humeral bone and the acromion bone. Its function is to allow smoother motion of the rotator cuff tendon underneath the acromion. If the bursa is inflamed, it can cause the rotator cuff tendon to impinge on the acromion instead of gliding smoothly. Over time, this can lead to tearing of the rotator cuff and inflammation of the underlying biceps tendon. Acromioclavicular joint arthritis can cause shoulder pain and is more often felt at the tip of the collarbone as it joins onto the scapula. Patients often describe pain when reaching across their body felt on the top of their shoulder. The most common treatment is removing the end of the clavicle that has become arthritic with spurs. This stops the bone-on-bone motion that causes pain on top of the shoulder. The shoulder joint itself can wear out from arthritis or wear and tear as well. This is not as common as arthritis of the hip or knee joints, but can still be very painful. Plain x-rays can show if the shoulder joint has arthritis, and in early stages is managed with activity modification and simple analgesia like paracetamol. If the shoulder arthritis is very symptomatic, a shoulder joint replacement might be indicated. Shoulder replacements have become very common and last just as long as hip and knee replacements. Sometimes patients may have all of these pathologies at once and require a longer surgical treatment to address them all.
This presentation forms part of the Adelaide Shoulder and Upper Limb Clinic's online educational series. If you would like to view more of our online education materials, please visit our website asulc.com.au.